Hello everybody. All right, so I'm back. This video is going to be on healthcare. So one of the things that I'm for and that I really would like to push for is universal healthcare. You know, a single payer healthcare system here in the United States. You know, I've had my mix in the healthcare world, you know, as far as being a patient or the loved one of a couple of patients, and even have been honored to take care of some patients, you know. So, and then have been in a position of not being able to take care of some patients, or not being able to take care of patients, but not being able to be a patient who could be taken care of. And so I want to start there. All right, so you know, healthcare can be, you know, very expensive. It can be a very serious burden on your finances. You know, it's one of those things that, depending on how serious the issue is, it can take you from a very comfortable lifestyle to a very, you know, into a struggling lifestyle very quick, you know. Or if you are struggling, you know, it can keep you in a very struggling lifestyle. And one of the things that, you know, you know, I'm obviously not rich. I didn't come up rich. You know, I actually came up from very humble upbringings. But when I came up in a family that was more so geared towards home remedies, taking care of yourself, you know, so on and so forth, you know, because we couldn't afford to, you know, keep running to the emergency room, or, you know, we didn't always have health insurance. You know, when my mom was alive and when she had her job, her career, thank God, you know, my brother and I were covered up until a certain age. And then after that, you know, not so much. And it's usually around that time of life when you start getting dinged up a little bit more, you know, busted up a little bit more, things happen, so on and so forth. So, you know, I have been able to be covered by health insurance through my mother. Through myself, not so much up until my later years. So there were times when I definitely should have gone to the emergency room, no question about it. I definitely should have gone to the emergency room, and it was one of those, you know, patch it up yourself, you know, or remove something yourself, or you know, basically just, you know, kind of take care of yourself and hope for the best. You know, no antibiotics, no you know, bedside surgery or anything like that. But I'm still here, you know, thank God. Then there was my time in the military where, you know, healthcare was readily available. You know, if you know, granted, we kind of have, you know, there's parts of our culture in the military where, you know, it's kind of frowned upon to seek medical help, you know. If it's not, you know, dire, real serious or anything like that, you know. And that's going to be an issue that I want to touch on in a later video, you know, when I'm talking about veterans benefits and, you know, how we struggle to get our benefits and stuff like that. But in the service, yes, I could, and that was probably one of the better times. It was so weird to be able to get up and go to the hospital, you know, when I was messed up and stuff like that. And I had been in the hospital quite a bit when I was in the military. A lot of it not for reasons I wanted to be there. Things just happened. And my family, you know, because I had a daughter who was born while I was in the service. You know, my wife was able to go to the hospital and, you know, everything was taken care of. And I mean, wow, you know, that was an amazing relief, you know, to not have that financial burden on me or my family. because not everybody qualifies for, you know, government assistance and stuff like that or whatever. So that's just kind of a brief history on you know, me not being able to get health care, me being able to get health care, you know, my family being able to get health care. And then if I can go back before my time in the military, you know, my mother was sick, and, you know, I'm going to try not to dig too much into that because I really don't like talking on that topic too much. But she has struggled with some health issues throughout her life. And without mentioning certain hospitals and certain doctors' clinics and stuff like that, you know, there's a couple places that kind of dropped the ball. Yeah, like I said, I'm gonna try not to touch on that too much, but you know, I was a family member of, you know, someone who, you know, I had to sit there and watch my mother die, and you know, could there have been things done, you know, earlier on? Yes, you know, and it's heartbreaking, you know, not only for me but for my family members and so on and so forth. Well, I also got to be a healthcare provider, so to speak, as a student nurse. You know, I was honored to be able to provide services to patients in the hospitals, you know, and I got to treat them, you know, with the love and compassion and stuff like that, you know, I believe my mother deserved, you know, when she was in the hospital. And, you know, it's unfortunate because I got to see families, you know, sit there and watch their loved ones die, you know, in a similar fashion that I, you know, had to watch my loved ones die. You know, I watched my grandfather die, you know, my mother die. I was blessed enough I didn't get to see what my grandmother went through. You know, that it just happened so quick. But, you know, I did get to see, you know, what other families went through, and I got to live through what they went through. And, you know, some of the stuff that I learned in nursing school and stuff like that is that a lot of things could be prevented if they're detected early on. You know, a lot of things could be prevented if, you know, proper education and health and all that good stuff is taken care of in a better way and you know, captured earlier on in the process, so to speak. So, you know, I feel for the families who have lost loved ones, you know, and I know people who have lost loved ones. I feel for the families who are going to lose loved ones, you know, and I'm upset that a lot of that is preventable, you know, through early detection, through, you know, better education and preventative measures, you know, and keeping yourself healthy and so on and so forth. You know, just being able to go to the doctor versus, you know, being at home, sucking it up and dealing with it because you can't afford it. You know, so, and I mean, there's so many more reasons, you know, that I have, but, you know, I believe that, you know, well, one, I believe that healthcare should be a right. You know, I believe that, you know, you pay your bills, you pay your taxes and stuff like that. You know, your tax money should go towards stuff that is worthwhile. You know, I guarantee you, if we saw a list of everything that our taxpayer dollars went towards, because I know not everything is listed. You know, some things are covered up under fictitious whatever. But if we saw everything that our tax, you know, dollars went through, I guarantee you we'd be like, we have way more than enough money for universal health care here in the United States. And that's what I believe in. I believe that, you know, it should be a right. I believe that, you know, we should have a single payer healthcare system, you know, and an effective healthcare system to where, you know, proper education is out there, you know, proper medical facilities, you know, strategically located and stuff like that, so that it's not a hassle, it's not a big struggle, you know, to seek medical help, you know, when you need it. You know, and even mental health, you know what I mean? It's just so many things in the healthcare field, you know, that should be readily available, that shouldn't be ridiculously expensive. Another thing that I believe in is caps on the prices of medication. You know, medication can be so expensive here in the United States. It can be ridiculously expensive here in the United States. I know there's a lot of people out there who know what I'm talking about. You know, and it can put a real burden on your wallet, you know, and a lot of these pharmaceutical companies, you know, they're making their money, you know, they're making their money. And I mean, it's kind of messed up because, you know, they have their hands involved with some of the lawmakers and stuff like that. You know, there's a reason that, you know, we can't travel to, you know, legally, you know, travel to places like Canada or wherever else, you know, Mexico, get things, you know, medication and stuff like that cheaper and bring it back to the U.S. You know, you're dealing with, you stepping on someone's money. Hold on just a second. All right, I'm back. Sorry about that. I'm at work. So I had to take a quick break. But yeah, you know, there should be you know, we shouldn't be able to just, you know, have ridiculous prices for medication and stuff like that. The prices should be reasonable. But excuse me. Sorry about that again. As I said in the previous video, I'll be keeping it real. I'm at work. I'm doing this video. What was I saying? Yeah, you know, so medication prices shouldn't be, you know, crazy out of hand. And another thing that I want to touch on is that medication, for the most part, treats symptoms. You know, we need to be getting to the root of what those symptoms are coming from. You know, so we shouldn't just be treating symptoms to be comfortable, you know, so on and so forth. We should be curing a lot of these issues or preventing these issues altogether, you know. So, and I really would like to drop a more in-depth video later on about healthcare, maybe even interview some people. But I really want universal health care here in the United States, a single payer system. You know, we pay our taxes, let that money go toward our personal health, our mental health, our physical health, you know, so on and so forth. So, yeah, I'll be touching on that, you know, more in depth in another video later on, but I just wanted to give you my view, you know, what I believe in, one of the things that I'll be, you know, pushing for if I'm elected. And, you know, we'll take it from there. If you have any ideas, you know, comments or anything like that, you know, feel free to drop them down in the comment description. This video will be posted on YouTube as well as any of my social media accounts. And I thank you for tuning in, and I will drop another video very shortly.